I will go ahead and get us started. Welcome, everyone. So delighted to have everyone join us today. This is the final presentation in the series that we've been doing this semester on community and academic partnerships to address environmental justice issues. Really delighted to have people here today. The focus today is going to be on community action to promote healthy environments, or CAPHE, which is a partnership that we'll introduce you to in a little bit more depth in just a moment. I will be part of the presenting team. Again, I'm Amy Schulz. I'm on the faculty in the Department of Health Behavior and Health Education, joined today by Angela Reyes, who is a Southwest Detroit resident, founding and current director of the Detroit Hispanic Development Corporation, and a founding member of the Community Action to Promote Healthy Environments Partnership, and Stuart Batterman, who's a professor in the Department of Environmental Health Sciences, longtime researcher and science advocate for around environmental issues in the Detroit metropolitan area, and a founding co-PI for the Community Action to Promote Healthy Environments Partnership. So we'll be talking a little bit about our work. Robin, you could go to the next slide. And before we begin, I do want to give a land acknowledgement. Go back one, there we go. And just recognize that our ability to come together today to share this work is a result of a gift from the Anishinaabe, the Three Fires Confederacy of the Ojibwe, Odawa, and Potawatomi, who, along with their neighbors, the Seneca, the Delaware, the Shawnee, and the Wyandot nations, cared for and lived on this land, the land from which on which the University of Michigan is based, for many generations. It was their gift of land for the explicit purpose of starting an institution of higher education that has made it possible for the University of Michigan to become the institution that it is, and for us again to come together today and think and talk about the important environmental justice issues facing Southeast Detroit, or Southeast Michigan, and is in the hope that the land acknowledgement really is in the hope that we can use our scholarship, the knowledge that we build, and the partnerships that we build through this work to promote equity and health equity. So we can go to the next slide. Quick review. We've been starting each of the sessions with a reminder or just a definition of environmental racism. Environmental racism as the disproportionate impact of environmental hazards on people of color. And environmental justice, we can move to the next slide, is a social movement that was developed, emerged in response to environmental racism. Environmental racism, or environmental justice, is defined as the fair treatment and meaningful involvement of all people, regardless of race, color, national origin, or income, with respect to the development, implementation, and enforcement of environmental laws, regulations, and policies. Robin, if you could click on the next, just click. Oops, okay, go back. Sorry, I thought there was a activation there, but I just want to use this to emphasize that environmental justice is both about the outcome in terms of the equitable distribution of exposures to environmental hazards, and it is also as much about the process. So there's a strong emphasis on the meaningful involvement of those who are exposed to excess environmental risk in the process of getting to equitable outcomes. So really making sure that there's active engagement and opportunities for influence in creating policies and enforcing policies and regulations that get us to the end of environmental equity. Okay, you can go to the next one now. And this series really has been about partnerships that strive to create equitable partnerships between community and academic partners in moving towards environmental justice. So I'm going to turn it over to Angie, who is going to walk us through the next part of the presentation.
Thank you, Amy. Good afternoon, everybody. This next set of slides, I just wanted to acknowledge that were shared by Simone Sagovic, who is the Executive Director of the Southwest Detroit Community Benefits Coalition. And these slides depict Del Rey community, which is part of Southwest Detroit, south of 4th Street, that has many challenges and being impacted by a lot of the issues that we're going to talk about here. So I just want to acknowledge the fact that air quality is a really critical issue for Detroit residents, that we have multiple pollutant sources in the city, industrial, truck traffic, a number of different areas, and large exposed population, many of which are very vulnerable. And there are disproportionate levels of adverse health outcomes associated with air pollutants like asthma, cardiovascular risk, and adverse birth outcomes. And because of this proximity of the industry and manufacturing to neighborhoods in Detroit, there are a lot of residents and vulnerable communities that have been disproportionately affected. Really the very definition of environmental injustice here in our community. Next slide. There are also many strengths and resources in the community of people who are working on improving the conditions in our community. This is one gentleman who lives in Del Rey and is providing fresh fruits and vegetables to community residents because there's no grocery store in that area that does that. Next slide. This has been kind of a mantra in Southwest Detroit that pollution has no boundaries, that we've had a lot of old infrastructure in the city, particularly in some parts of the city, and people don't always realize what the health impacts are because of their living constantly under those conditions. Sometimes you take it for granted that the conditions that exist are what's always going to be there. Next slide. This slide is of the Southwest Detroit zip code 48217, which is in direct proximity to the Marathon Oil Refinery. And a lot of people, particularly elders, live in very close proximity and adjacent to all these land uses that are really incompatible with human life and have really disproportionate impacts on the health of the community residents. Even when EPA staff and governor's staff were taken on a tour of this area, they were holding their noses and getting headaches because the smell and the air quality is so bad. But they get to go home where the residents have to live with this all the time. Next slide. Again, Marathon has continually expanded their footprint. So they expanded again their capacity to refine dirty tar sands that come from Canada, which has really not only expanded their footprint, but the impact on the health and the air quality of the people in that area. Next slide. There's also Zug Island, which just recently closed, which is a steel refinery, and the U.S. Steel, it's gone through several different hands over the years, but it's one of the only remaining coal-fired steel plants in the country. And then we also have the DTE huge facility that is also coal-fired, that's in the close proximity to the community as well. The next slide. And this one shows how close in proximity homes are to all of these manufacturing plants. So you can see Zug Island, the steel plant behind it, and then the homes that are right almost on top of it. Next slide. And here you can see some of the scrap metal yard. There's a lot of fugitive dust that flies out from there because these piles are not covered. So that also contributes to all of the pollution in the air that people are breathing in. And these logistics centers are slated to expand all in that area, including the diesel exhaust that also is a big concern with the amount of truck traffic in the area. Next slide. So you can see here, this playground, which there's the water treatment plant right behind it. This is at the Del Rey Community Center in that area. And kids play soccer there all the time. This last Sunday, it was packed with people playing soccer. So people are exposed all the time to all these multiple pollutant sources that you just saw. It's a large exposed population. We have more children under the age of 5 in this area than any other part in the city of Detroit. And again, there's a disproportionate level of all these negative health outcomes because of this close proximity. And what you can't see here is immediately to the right of this playground is the I-75 overpass with a significant amount of truck traffic. And actually, this playground used to be located directly under the overpass. And at one point, a truck literally fell off the freeway overpass onto the playground and caught it on fire. So that's also another health hazard in the area. So CAPHE brings together a number of researchers and community residents and community organizations who are really dedicated to addressing all of these issues around air quality in the city of Detroit, and to really look at what the opportunities are to build on some of the existing efforts and to extend those efforts to improve air quality and to reduce the health inequities on the population in the city of Detroit. Next slide. And I'm going to turn this, I think, leave over to Amy. I think Amy or Stuart.
Thank you, Angie. Thank you. So yeah, so we wanted to share just a little bit of our work with Community Action to Promote Healthy Environments. Robin, if you'll take us to the next slide. I want to acknowledge the multiple partners who make up the CAPHE partnership, representatives from many community-based organizations, environmental justice advocates in the city of Detroit and beyond, community-based organizations that are located in EJ communities. We also have representation from multiple universities, so our Ann Arbor campus, School of Public Health, the U of M Dearborn campus, Detroit Mercy Law Center is also part of our partnership. And who am I forgetting here? The Detroit Health Department is part of our work, and also EGLE, the Michigan Department of Environment, Great Lakes and Energy, which is one of the major regulatory agencies. So we cast a broad net in terms of the partners that we bring together as we continue to think together about air quality and ways to improve it and reduce the health inequities that are linked with it in the city of Detroit. You can go to the next slide. Just really quickly, our overarching goals as a partnership have been to develop a multi-level, scientifically informed public health action plan with specific action strategies to reduce air pollution and adverse health effects, and then to promote implementation of components of that plan. We actually have developed our plan. We launched it in 2017. I'm going to talk a little bit about the process that we used to do that, and then we'll be sharing some of the current activities that we're working on to promote its implementation. So you can go to the next slide, Robin. So our work builds on 3 longstanding community-based participatory research partnerships. So we began our work together as CAPHE in 2014, but prior to that, there was first of all a lot of community activism around environmental justice issues, and there were 3 partnerships that had done preliminary work around air quality in the city and its links to health outcomes that came together to create the CAPHE partnership. So many of us have been working together at this point for 20 years or so, building the evidence base and the foundation for the work that I'm going to talk about today. Our aim is to increase knowledge about factors influencing exposure to air pollution, both among community residents, as Angie mentioned, but also about policy and among policy and decision makers, so that they can be making decisions that are informed by scientific evidence around the impacts of air quality for health outcomes. Our goal is, again, to translate findings into a public health action plan and then to implement components of that plan, either through policy or practice solutions, in order to reduce the exposure to pollutants among Detroit residents and to mitigate adverse health effects. As you will see as we continue through our presentation, we have a very strong focus on equity. So we're constantly looking at and thinking about where are the areas, where are the geographic locations, who are the populations that are disproportionately impacted by air pollution, and then focusing our energies there. You could go to the next slide. Okay. So one example of this is that as we began our work together, one of the things that we did was to think about this idea of cumulative risk. This is a concept that comes directly out of environmental justice movement analyses of the failures of previous work around air quality, to understand that this idea of cumulative risk. So residents of environmental justice communities are not only exposed to pollutants from a single source or for a single pollutants, but often they're exposed to constellations or mixtures of air pollutants that come from multiple sources and have combined multiple pollutants within them. On the left-hand side, the map on the left of this slide shows a map of what we do, of one version of cumulative risk, which is really thinking about exposure to multiple air pollutants and the respiratory and cancer risks that are directly attributable to air pollution in the Detroit metro area. The way that this map is constructed is it's constructed by stacking multiple pollutants on top of each other and then cutting them into quintiles. So 20, the lowest 20% of exposures, 20 to 40% exposures, and on up. The yellow areas in this map, I should orient you, the black outline in the middle is the outline of the city of Detroit. Detroit is located within Wayne County, and then the two counties immediately to the north are Macomb and Oakland County. The yellow areas are census tracts with the lowest levels of air pollution and associated health risks. And as we get increasingly darker colors, moving through the oranges and to the reds, we're seeing increasingly heightened exposure. And you can see that the highest levels of exposures are clustered within the city of Detroit and some outlying areas like Pontiac, and also following the roadways. And that's partly because one of the indicators included in this map is diesel pollutant, so it follows where there are trucking routes and also train routes. On the right, we're looking at a map that shows a different dimension of cumulative risk. And in this map, we're looking specifically at population characteristics that are associated with heightened vulnerability to air pollution. It's a similar idea. We stack multiple indicators on top of each other. The population characteristics map includes things like the proportion of households that have low wealth or have incomes below the poverty line, that have low educational attainment, also the proportion of households that have children under the age of 5 or elders over the age of 65, which we know to be particularly susceptible to adverse health impacts. And we use these two maps juxtaposed against each other to illustrate the correlation between many of the communities that have the highest levels of exposure to air pollutants and health risks are the same communities that have highly vulnerable populations. If we go to the next slide, this just really quickly shows the same two slides on the right. We see the same two slides we just saw in the previous slide, or the same two maps we saw in the previous slide. On the left, you see that against the proportion of people of color. So again, we see that we have disproportionate exposure in areas where there are high concentrations of people of color. And then the final slide is just to illustrate and remind us that, you can go to the next one. Yeah, I should say the final slide. The final set of maps is to remind us that there is a policy history that drives what we currently see in terms of exposures and population vulnerabilities. And the map on the left is a map of redlining in the city of Detroit, with the areas that show in red, the areas that were defined by the mortgage companies as areas that were risky to invest in. And that decision on the part of banks drove a multi-decade process of disinvestment within red line communities, and then the yellow communities are also defined as sort of marginally risky and a higher risk for investment. And just to again show that those areas that have historically experienced disinvestment, divestment from those communities are also the areas that have the highest levels of exposures and currently some of the highest concentrations of vulnerable populations. So this lays out some of the lay of the land in terms of what we're looking at in terms of exposure. We can go to the next slide. Part of what our team did also as we were laying the foundation for our recommendations were to understand current costs associated with air pollution. The set of numbers on this slide were done by Stuart Batterman and one of his doctoral students, Sheena Martinez, who worked on this project, estimating the number of deaths attributable annually to air pollution in the Detroit metro area, almost 700 deaths. About 1,800 hospitalizations and emergency room visits, and thousands of missed school and work days. Dr. Martinez and Dr. Batterman converted those health encounters to monetize cost and estimated that the current cost associated with air pollution in the city is about in the metro area, is about $6.9 billion annually. And we have been able to document that these effects occur disproportionately in Detroit and in outlying areas with high concentrations of poverty, African American and Latino residents. So they're inequitably distributed. Next slide, Robin. We also quantified estimated reductions in morbidity and mortality under a number of scenarios, and this was to help inform the recommendations that we made in our public health action plan to try to understand what would be the impact if we were, for example, to shut down the 3 coal-fired power plants that substantially contribute to sulfur dioxide into the air in the city of Detroit. Those multiple scenarios helped us think about where would we get, for example, the most bang for our buck with a different, with various recommendations that we could make in the public health action plan. You can go to the next slide, Robin. All of the modeling and the science that was used to inform our recommendations are publicly available on our website in something called the Public Health Action Planning Resource Manual. We encourage anyone who's interested in air quality and doing work around air quality in Detroit to access that as a resource to provide a scientific foundation for thinking about strategic actions that can be taken. Next slide. Once we had done all this work, we spent a lot of time thinking together about what are our specific recommendations. These show some pictures of us, the members of the partnership, as we were developing our recommendations. You can go to the next slide. Once we had a draft of recommendations, we then took those out and held a series of community meetings to talk more broadly with representatives, members of communities throughout the city of Detroit to help us refine and fine-tune those recommendations before we finalize them. The next slide, I think, shows the launch of our public health action plan. Yes. You can see Angie at the podium talking about the importance of air quality in Detroit and several of our other partners behind. The Public Health Action Plan was launched in 2017 and include 25 specific recommendations and action strategies for implementing those recommendations to improve air quality in the city. We can go to the next slide. Since that time, we have worked actively to use the science that we built and to use our alliances and relationships that were developed through this process to comment on policy proposals that have been put in place to educate policymakers and to work with community members. So these are a couple of examples, comments that we have provided on various legislations or decisions, permitting decisions that were being moved forward, where our evidence base was able to provide a foundation for making comments and recommendations. You can go to the next slide. We also have worked very actively with policymakers creating or convening, for example, legislative luncheons to inform them about the science and the health impacts of air pollutants in the city of Detroit. We do policy advocacy training for both for faculty members and for community members to try to build our collective capacity to work with policymakers to inform decision-making processes. We can go to the next slide. And we have conducted a number of health impact assessments. So one of our major recommendations is that we should make better use of health impact assessments before we make policy decisions. Angie, this one has your name on it, so I'm passing to you.
Thank you, Amy. Yeah, so there's been a number of efforts that we've taken from the recommendations that we had developed, and a big one was really doing a health impact assessment wherever there was going to be a major project in the community, as Amy had said. And of course, one of the largest ones, again, impacting the Delray community is the Gordie Howe Bridge, international bridge that's being built. So the community is really being sandwiched between two international bridges that are about 2.5 miles apart. So really looking at what the impact was going to be, we conducted a number of surveys of community residents over an initial one that was conducted prior to CAPHE, and then this was a follow-up one looking at what the impact has been specifically on the health of the residents in the area. And it really we really found a lot of data to demonstrate that there were huge inequities in the health status for people who were close to the freeway, to traffic that was being increased, particularly the truck traffic close to the bridge. And then we really looked at what were some of the recommendations that we could make that would help to mitigate some of those impacts, like expanding home buyouts to allow people to move away from the immediate impacted area, or retrofitting their homes so that they could reduce the amount of pollution inside their home. Next slide. Some other of the recommendations had to do with mitigating the impacts of all the truck traffic. So really looking together with our city council member from the area, Raquel Castañeda Lopez, who's really been instrumental in helping us look. For the first time, the city does not have defined truck routes. So really trucks are going everywhere through very highly populated areas in the city. So looking at where trucks should be going to reduce the amount of exposure to residents, and then also developing anti-idling campaigns so that the trucks are not just parked and running their engines through the community, and increasing even the amount of exposure to the diesel fumes. Next slide. So you can see that some of the mapping that we did through the impact assessment was to really look through the research at where the exposures were, and where they were coming from and what was in the pollutant sources. So you can see from this map where the most impacted areas are. And as Amy had mentioned earlier, looking at who lives in the area, when you layer that on top of this, really seeing who's being impacted and by what. So really having the science to be able to defend the case that we were making for reducing the amount of truck traffic that was impacting the community, or putting in ways to mitigate the impact. We really needed the science to be able to make that case, so that there would be investments from the federal, state, and local government in the community to improve the health impact. Next slide.
Angie?
Yes.
Should I talk about these?
Oh, yes.
Sorry, if you could go back just a second. I'm Stuart Batterman, as Amy introduced, and I just wanted, first, while I recall, wish everybody a happy Earth Day a day or two early. So these slides are just showing in the black circles some of the heavy industry sources. These are known as major point sources, mostly in the Delray or Southwest area. And then the shields in yellow, and underneath those kind of red diagrams, are air monitors. And the partnership has been, I think, very influential in terms of getting the state EGLE, the regulatory agency to install and enhance the monitoring capabilities in the area with the addition of 3 new monitoring sites for ambient air pollutants. And the stuff at the right is just showing you some of the levels of black carbon, which is an air pollutant, part of particulate matter, which is related primarily to soot or diesel exhaust. And without going into the details here too much, we do see sort of a time of day effect and also a spatial gradient that we would expect. And so this is part of what we call source apportionment to understand which sources are contributing which pollutants. And the most important take home here from the black carbon is that Southwest Detroit residents are exposed to more than twice as much of this diesel exhaust as communities just a few miles away even. And at the left, what we're showing are the influence of local sources with respect to directional effects, indicating sources of sulfur dioxide, which is largely from coal combustion, which doesn't have scrubbers. And not only, as was mentioned earlier, are these some of the, I won't say last remaining coal burning steel mills and power plants, but they're also ones that don't have sulfur dioxide control. Next slide, please. And so on the left, this is particularly good at showing directional influences, and the arms of the red figures point to where the sources are, and they're in Zug Island. This is sulfur dioxide that we're looking at. And then modeling, dispersion modeling can show these hotspots, which are indicated by the colored diagram over on the right. And you can see with the red circles where the sources are and the hotspots that follow around them. And as was mentioned earlier, the juxtaposition of this very heavy industry and this archaic industry, even with population centers and schools and so forth, is really problematic. Next slide, please. So one of the offshoots of CAPHE was to have a mobile monitoring platform. And this is showing you a truck that we outfitted with a bunch of fast response instrumentation to, in fact, fill in the gaps between the areas that were monitored by being able to drive around and characterize the exposure of the population. And this would help fill in the gaps with respect to exposure for the health impact assessment and for other purposes. So we measured a number of toxic gases, conventional pollutants like PM 2.5, as well as greenhouse gases. Next slide, please. And this is just some preliminary mapping showing you the different spatial patterns that are associated with some of the pollutants that we measure. And there have been a number of offshoots from this work as well. For example, we're looking at oxidant pollution right now because this region is a non-attainment area for ozone, which means we don't meet the ozone standard, and also a non-attainment area for SO2. Again, the same meaning, we don't meet the SO2 standard. But on top of that, we can also do things like look for leaks and fugitive emissions and so forth. Next slide, please. Another offshoot is a community noise survey. And environmental noise is a very important factor that can affect your hearing if it's loud enough, but at lower levels, sleep, health, and cognitive performance. And we've engaged the community and youth in terms of making noise measurements with some of the partners that we have, Southwest Community Environmental Benefits Coalition. And the plots here show locations where we conducted noise surveys, as well as indoor and outdoor air quality measurements by the residents, of the residents in the community. The scatter plot is showing the different noise metrics, but importantly, a number of the homes exceeded 70 dB on a time-weighted average, which puts them essentially above guidelines that are used for noise abatement. And this is largely due to heavy-duty commercial trucks going up and down residential streets. And so this is one of the earlier studies, or certainly the first in the area, to look jointly at air pollution as well as noise. and both can be above guidelines, above where we'd like them to be. Next slide, please. So throughout this work, we have, as Amy mentioned at the onset, really engagement with the community to develop a scientific evidence base, to have our partners involved in all aspects of the research. And in our latest work now, we're funded for a second a renewal of our project. We have a couple of additional goals. And the idea here is first to improve the monitoring that's going on with respect to air quality pollutants in the area, and to develop a number of additional monitoring sites to, again, help fill in those gaps. The community is engaged in identifying these sites. On top of this, we want to have a portal that would allow folks to get information from the monitoring sites to be able to make it actionable for them. And then we have an effort to have educational materials that would relate to this air quality data. So this is one new thrust of the next evolution of CAPHE, is to essentially improve the monitoring and the access to monitoring information. Next slide, please. And then the second thrust here that I'll talk about is to improve the indoor environment in schools and childcare centers. And this would be done in the short term, most practically, by utilizing an intervention consisting of filters. So Detroit has hundreds of schools and childcare and other youth serving buildings that have, for the most part, pretty rudimentary, if any, air filtration. And much of the health impact, not all of it though, but much of it is associated with particulate matter, which can be relatively easily removed using appropriate filters. And many of the schools don't have filters. They may have radiators, and they don't actually have a central air system that can use the filters. Other schools typically don't have very good filters, which essentially remove a negligible fraction of PM 2.5. So in this thrust of CAPHE, we're going to be choosing schools with our partners' engagement, putting in additional filters, monitoring the effects, and getting, as the slide indicates, engagement from the parents, the youth, the educators, the schools, and so forth. And one of the additional programs is this Environmental Health Research to Action Youth Program, which is designed to have intensive summer camps and other activities for youth. Next slide, please. I'll let Amy conclude.
I think this is actually Angie.
Oh, Angie, I'm sorry.
Yeah, that's all right.
That's what happens when you're doing tag teaming. So just to conclude, using a community-based participatory research really has created opportunities for all the various partners to work together. All of these issues were generated by the community concerns that had been expressed over many decades, and being able to bring all the different collaborators together along with the scientists has really helped us create a really powerful initiative to conduct the research, to disseminate that information to community members as well as policymakers, to translate those results into recommendations that not only policymakers can implement, but also community residents can take some action to implement as well too, and to provide support for those actions to make changes. And using CBPR as a tool for creating that ongoing policy change that really can have the long-term impact on the health and well-being of communities, that is really so critical. I often tell people that, when you go to policymakers, if you're a scientist and you have a lot of really good data, but don't live in the area where that policymaker is being elected they may thank you for the research, and the research goes to the bottom of the pile. In the same token, if you're a community resident and you go and tell them, you know, the air quality is really bad, we need to make change, and you don't have the research or the data to back it up, they may thank you very well and say, okay, but there's nothing we can do about it. You don't have any proof. But when you go together as constituents of those policymakers with all of the research and the science to back that up, it's a very powerful way of being able to make your case for long-term change. Next slide. So I just want to acknowledge all of the different partners that are involved. It's a pretty broad set of partners of community-based organizations, which includes many residents in the areas that are impacted, as well as University of Michigan and places like the Eagle from the State Department and the Detroit Health Department as well. So including them in all these efforts has been really critical. Next slide. And thank you to my co-facilitators, Amy and Stuart, for and all of you for listening in.
And if I may, I really encourage you to go to the CAPHE website, because we have tremendous resources there. You may have to dig a little bit to get to them, but we've certainly tried our best to disseminate materials there. And if anybody wants to get in touch with me and you don't know me, that's not my correct email, but it's Stuart B.
Sorry about that, Stuart.
No problem.
It's missing a T.
Yeah, it's a new name for me, whatever.
Thanks, everyone.
Thank you, yes.
We do have a few minutes for questions. I do want to, while folks are thinking if they have questions, feel free to put them in the chat, or you can raise your hand on the, using the Zoom thing, and let us know. I want to recognize a number of our partners and colleagues who have contributed to the work of CAPHE who are on the call today. So Teresa Landrum from 48217, Gregory Winnook, who was a research assistant with the project several years ago. I see somebody from the Ecology Center. I can't tell if it's Catherine. Sharon Sand, who formerly helped with project management. And I'm sure I'm missing some. I saw a few other folks who are members of the partnership. So thank you guys so much for joining us today and for all the contributions to the work over the years. So questions. Let's see. So we have one question that says, please identify information in this presentation that's new. Do you want to clarify that question? I think we did share a number of our specific findings from the research, but feel free to unmute yourself and maybe help us understand if there's something in particular there that you're trying to get to. And it is Catherine from the Ecology Center. Hi, Catherine, thanks. Oh, okay, sorry, I was multitasking. Okay. So question from Jessica and Stuart, this might be for you. Given the efforts to increase the objective, oops, it just scrolled off my screen, the objective pollutant monitoring discussed here, are there corresponding projects or innovations to measure odor perceptions or other symptoms relative to short-term increases in ambient pollution?
Okay, so we have a online survey and phone app which asks people about this, and they can quite easily access that, drop a pin where they are, and provide a brief note about what they smell or what they perceive or what they see. And this has been active, and there's, we're using the partnership and promoting that, and there's been an uptick in the number of responses. That's one way we're using perception this way. There have been a number of surveys that have been part of the health impact assessment as well, to ask folks about their feelings that way. And for the schoolwork, we're discussing whether we want to do something like this as well. I should say that it's important to complement this kind of work with the measurements of pollutants as well, but certainly perceptions are very important. And in the indoor and the outdoor environment, understanding the perceptions is really a factor in your quality of life, which is often severely degraded in Southwest Detroit.
Thank you, Stuart. So we have two follow-ups from MEG. One is that indicating that most of what they heard in this presentation seems to be old information, and that the pollution sources have been mostly the same for generations. I think, Stuart, do you want to take a first pass at articulating what was new in the science that we used, that we developed through this project? And then I can maybe add to that, but maybe you'd like to go first there.
Yeah, I'm not sure about the science question, what was new or what was old. Let me first address the industry. Some of these sources have been out there using essentially the same hardware since the late 40s, believe it or not. And this is a very old industrialized area, of course, but we're at the point now where a number of the facilities are, have systems that are 50, 75 years old. And obviously technology has changed tremendously. The latest one that I've heard of just the other day was the steel mill and their precipitator, which is a very critical pollution control device, basically is past the point of being repaired. And these things remove 99% typically of particulate matter. And when they fail, that means you have a 100-fold increase in the emissions. And so they're shutting it down, rebuilding it. I already talked about the scrubbers. There aren't scrubbers on these facilities. And this is in part because many of these older industrial facilities are what we call grandfathered in, means that they don't need to comply with the source emission control technology requirements, given that they're old. They still need to meet certain requirements, and they're not supposed to cause exceedances of air quality standards, but nonetheless, the technology and the operation that would be applied to a new facility, it would be much more stringent. With respect to new science and things like this, well, that's an interesting question. We want to use the latest scientific techniques to understand what the health impact is, what is the sources, the apportionment types of things. There have been advancements, and we try to use the latest techniques and tools, but in a lot of cases, this is an application using existing tools and science and applying it to an area which is quite heavily impacted. So I hope that gets at what the questioner was after.
If I can,
oh, go ahead, Angie.
I was going to also say that that even though those pollutants have been around forever, and scientists may be aware of the impacts, the community doesn't have that data, and neither do policymakers. So when we were taking this data to policymakers in the governor's office originally around the negative impacts, the response from folks from the governor's office was, how do we know that people aren't just getting sick from people smoking inside? So we have to be able to use whatever data we can to be able to make the case in order to make change, because there's also going to be pushback for making those kinds of changes. So even though we know it's been around forever, I've lived in this community all my life, and I've been smelling that the air was bad all my life, but we didn't have the data to prove it. So it's still really critically important that we're able to work together with researchers to get that data to be able to really make the kind of changes that are going to have an impact on our community. We get dismissed way too often otherwise.
Thanks, Angie. So we have more questions that we're going to be able to deal with in the time that we have, but the next one in the queue is, can you please share how long it took to develop and establish those partnerships? So I think that maybe the CAPHE partnership. I might start by just reiterating that the CAPHE actually emerged out of 3 previous partnerships: the Healthy Environments Partnership, the Detroit Urban Community, sorry, Barbara, the Detroit Urban Research Center, and CAAA, which is Community Action to address asthma. And those projects, CAAA started, I believe, in 1998. The URC started in 1995, and Healthy Environments Partnership started in 2000. So many of us who were part of those early partnerships worked together for a period of 20 years or so. We came together initially in 2013 to write the grant proposal that became the CAPHE partnership. So long story short, many of us have been working together for a very long time. We spent a lot of time early in the life of our partnerships really working on how we will work together as a partnership. And even in CAPHE, we are continually bringing in new partners into the work that we do together. So it really is an ongoing process. You don't have to wait 20 years to start the work together, but it is, once you begin to do the work, investing in those relationships, investing in those partnerships. And one thing I did not mention earlier, but that we have an ongoing evaluation process that is a participatory, formative evaluation process. And so that means that all of the members of the partnership work together on an annual basis to self-evaluate how we're working together, as well as our products. So that, and the purpose of that is for self-reflection and for us to think together about how we can improve our process of working together, as well as the outcomes that we're moving to. So long story short, it's an ongoing process, and you have to start somewhere, and you can dig in and begin the work, I think, pretty quickly, but it's important to continue to be self-reflexive about it. All right, let's do one more question. We have, do you all feel like the Biden administration will influence change with respect to environmental policy regulations? $1 million question here. I know the previous administration rolled back regulations and decreased clean air and water prosecutions. Stuart, I'm going to give you first option here.
Well, that's a huge question. Well, you know, everybody reads the news, and there's been discussion about carbon goals becoming carbon neutral much sooner. Obviously, this also requires Congress to be engaged. From the standpoint of certain actions taken under the previous administration, they have dumped some of them. There is pending a number of changes in rules. So yeah, I mean, I think many folks can be a lot more optimistic than we have been for the last couple of years. The implementation of the Clean Air Act, and which is a very technical piece of legislation, which is implemented by the state, is probably not going to change that much. And the idea here is that some of these pollutants that Angie was talking about, which have been with us essentially in the same, well, actually in high concentrations, regulated by the Clean Air Act since 1970, are going to change for a number of reasons. It's not clear to me that the primary reason that they're going to change is the Clean Air Act itself, unfortunately. It moves slowly. There are other forces at play. Technology is getting better. We're moving away from a lot of the gasoline and potentially from the diesel. And so while the Clean Air Act is very important in this, the state also needs to be involved. And it's a very complex question that I just can't do honestly respond to in a good form right now. But yeah, I think it's a time for optimism.
Angie, did you have anything you wanted to add to that?
I think Stuart pretty much covered it. We continue to be optimistic, and hopefully not naively overly optimistic.
Thank you. And just to maybe reinforce something that Stuart did mention, I think that federal legislation is incredibly important and we all need to continually work on that front. I think one of CAPHE's philosophies has also been that there's much that can be done at the state and local level, and that it is really imperative for us to leave no stone unturned as we think about opportunities for change. So thank you, Angie and Stuart, for co-presenting. Thanks to all the members of the CAPHE partnership who joined us in this endeavor over the last 8 years and also on this webinar. And thanks to all of you for joining us for the conversation today. Feel free to reach out to me, to Angie, or Stuart. I did put Stuart's correct email address into the chat for those of you who would like to continue the conversation. So thanks, everyone.